All right, today we are diving into a really complex topic, a childhood cancer called neuroblastoma. Now, I know that sounds heavy, but our job here is to break it down together. We're going to look at where it comes from, how doctors find it, and what the fight against it actually looks like. So let's get into it. So let's start with a really powerful fact. Neuroblastoma is the #1 most common cancer diagnosed in a child's first year of life. That single piece of information tells you its story starts incredibly early. We're talking before a baby is even born. So here's how we're going to tackle this. First, we'll look at its origins, this idea of a cancer from before birth. Then we'll unmask the symptoms. After that, we'll get into the diagnostic detective work. From there, we'll talk about the battle plan, and we'll finish up by decoding what the prognosis really means. Okay, let's jump right in at the very beginning. The name itself, neuroblastoma, actually gives you a clue to its origin story. This is what's known as an embryonal tumor, which basically means it comes from cells that are part of our earliest development. Okay, so the key phrase here is neural crest cells. What in the world are those? Well, you can think of them as these super versatile little building blocks in a developing fetus. Their job is to migrate, to travel around, and help build what becomes our fight-or-flight nervous system. But in neuroblastoma, it's like some of these cellular building blocks go off script. They get lost on their journey and start building a tumor instead of doing their job. And, because these neural crest cells are travelers, these tumors can pop up almost anywhere along their path. The most common spot, by far, is in the adrenal gland, which sits right on top of the kidney. But they can also show up in nerve tissue all along the spine, in the abdomen, the chest, even the neck. And this is one of the most incredible and frankly baffling things about neuroblastoma. Even though it's a malignant cancer, sometimes, especially in very young infants, the tumors can just vanish. They regress all on their own, without any treatment at all. It's a true biological mystery, and it just shows you how wild and complex this disease really is. So, if this cancer is growing deep inside the body, how does anyone even know it's there? That brings us to our next section, how this disease actually unmasks itself through its symptoms. Well, this is where it gets tricky, because the symptoms really depend on where that tumor is located. But for the most part, doctors tend to group the signs into 3 main categories. So bucket number 1 is symptoms caused by the tumor itself just being a physical mass, so a lump in the belly or pressing on nerves. Bucket number 2 is signs that the cancer has spread or metastasized, things like bone pain or distinctive bruising around the eyes. And bucket 3 is really interesting. It's from the tumor acting like a faulty hormone factory, pumping out chemicals that cause things like a racing heart, flushing, or severe diarrhea. And here's a very specific and kind of unforgettable example. When neuroblastoma spreads to the skin, it can create these little bluish raised bumps. The look is so distinct that it actually has a name: blueberry muffin syndrome. It's rare for sure, but it's a very clear sign of metastatic disease. Now this is so important to understand. In up to 70% of cases, by the time a child is diagnosed with neuroblastoma, the cancer has already spread. And that fact alone is what makes this such a huge challenge to fight. Okay, so you've got these varied symptoms, these hidden tumors. How do doctors actually pin down a diagnosis? Well, this next part is really like a piece of medical detective work, where they have to find and piece together all the different clues. One of the biggest clues, believe it or not, comes from a simple urine test. See, because these tumors are made of those rogue nerve cells, they often produce a ton of extra stress hormones. When the body breaks those hormones down, the waste products, these things called VMA and HVA, spill into the urine. In about 90% of patients, these levels are sky high, giving doctors a massive, non-invasive clue that something is going on. All right, then comes the imaging toolkit. A simple X-ray might show some telltale little calcium specks inside the tumor, but the real workhorse is a CZCT scan. That's a CT scan with a contrast dye that gives a super clear picture of the tumor. And finally, there's a specialized MIBG scan. It uses a radioactive substance that, get this, only neuroblastoma cells absorb. So wherever the cancer is hiding in the body, it just lights up. So once the diagnosis is confirmed and the doctors know the what and the where, it is time to create a battle plan. And treatment for neuroblastoma is definitely not a one-size-fits-all approach. It is staged very carefully based on how advanced the disease is. The approach is really logical. It just escalates with the threat. So plan A, the first step, is always to just surgically remove the tumor if you can. If it's too big or in a tricky spot, you move to plan B. Use chemo or radiation to shrink it first. But for that large group of kids where the cancer has already spread, you go straight to plan C, an all-out aggressive chemotherapy regimen to attack the disease everywhere at once. And that brings us to the final and most critical question. What's the outlook? I mean, we've seen how neuroblastoma is this disease of crazy contrasts, from disappearing on its own to spreading aggressively. Well, it turns out doctors can now actually decode a tumor's biology to get a pretty good idea of which path it's going to take. What researchers have found is that there are specific features, both about the patient and the tumor itself, that act as really powerful predictors. They help doctors sort cases into what they call favorable or lower risk and unfavorable or higher risk. And that classification is absolutely key to deciding how aggressive the treatment needs to be. So let's quickly walk through this table, because this is fascinating. First up, age. It's a huge factor. For reasons we don't fully get, kids diagnosed under 18 months old just do so much better. Next is something called DNA ploidy. It sounds complicated, but it just means the amount of DNA in the cancer cells. And here's the weird part. Having more DNA than normal is actually a good sign. But the biggest, most important factor of all is a gene called NMYC. If that gene is amplified, it means the cancer cell has made hundreds of extra copies of it. You can think of it like the cancer's gas pedal is stuck to the floor. An amplified NMYC gene is the single strongest indicator of a very tough